So we'll finish up this chapter looking at nosocomial infections and universal blood and body fluid precautions. Then we'll take a look into Koch's postulates and understanding how we discover which pathogens cause which diseases. And then we'll move into a brief look at epidemiology, which is the study of disease in populations. So you've probably all heard of nosocomial infections. These are infections that people pick up in hospitals. So the hospital is the source of the disease. There are about 2 to 4 million cases each year, which result in nearly 90,000 deaths. I think these statistics are fairly astonishing. The pie chart over here on the right will give you some idea of what sorts of infections those are. But the most common ones are urinary tract infections, probably most likely from the use of catheters, respiratory tract infections, and then surgical site infections. But we also see some skin infections, some things like meningitis and gastroenteritis, as well as septicemia. Hospitals both attract and create compromised patients. Because of an increased use of antimicrobial drugs, not only do we have more compromised patients, but we also have much more drug-resistant microbes. So really, medical asepsis is of absolute utmost importance. Washing hands is one of the most important things that caregivers can do. So naturally, the medical and dental settings require really stringent measures to prevent the spread of nosocomial infections. Even with these precautions, though, as we've seen, infection rates are really pretty high. Previously, our control guidelines were disease-specific, and only clearly identified infections were managed with any sort of restrictions. However, the AIDS epidemic spurred the CDC to bring in more stringent guidelines. These were the universal precautions. So no matter what the patient was, we assumed that that patient could harbor infectious agents. So the universal precautions are a set of guidelines that help us maintain an aseptic environment. These guidelines include the body substance isolation techniques, or BSI techniques, that are to be used in the cases of known infection, as well as precautions that are designed to protect all individuals in clinical settings. That includes the patients, the nurses and doctors, the public that might be visiting patients, and so on and so forth. Any of you presently working in the medical field will be familiar with universal precautions. So the goal of studying infectious disease is to determine the precise etiologic agent, or the causative agent. We take for granted these days that we understand that certain infections are caused by a particular microbe. However, it was not always this way. More than a century ago, Robert Koch realized that to prove the germ theory of disease, he would have to develop a standard for determining the causation of those diseases. And that standard would have to stand the test of scientific scrutiny. So he came up with a series of postulates. Those postulates are outlined over here on the right side. First, we needed to find evidence of a particular microbe in every case of a disease. Isolate that microbe from an infected subject and cultivate it in a pure culture inside the laboratory. Then we would have to take that culture and inoculate a susceptible, healthy subject with the laboratory isolate and observe the same resultant disease with the same symptoms. Finally, you would have to re-isolate the agent from this subject to show that this was the causative agent. These postulates allowed the discovery of many, many different pathogenic infections and what their diseases look like. Now let's venture into the study of diseases in populations, or epidemiology. Epidemiologists study the frequency and distribution of disease and other health-related factors in defined human populations. This study involves not only microbiology, but also anatomy, physiology, immunology, medicine, psychology, sociology, ecology, as well as statistics. So you have to have a lot of skills to be in the field of epidemiology, but it's a fascinating field. One of the first ever recorded epidemiologists was Florence Nightingale. She helped lay the foundations for this field. Back in the 1850s, she arrived in Turkey during the Crimean War, and she realized that deaths were occurring at an astonishing rate. Almost 20% of soldiers died, compared to 2.9% that we saw in the Vietnam War. She noted also that many more men were dying of disease than they were of the actual war wounds themselves. So she insisted on cleaning up the filth. She insisted that soldiers got clean bedclothes and clean towels, and that the floors were scrubbed. Now, this was years before the germ theory of disease, so nobody really understood that there were particular pathogens that caused these diseases. However, Florence Nightingale definitely recognized that filth had something to do with it. And it's her record keeping of who was dying of what that helped them establish a much safer environment. The techniques of epidemiology are also used to track things like the influence of various behaviors like exercise or smoking or eating high-fat diets. So epidemiologists are primarily concerned with virulence, portals of entry and exit, and the course that a disease runs. They're also interested in surveilling the diseases. So they'll collect and analyze data on the rates of occurrence, the mortality rates, the morbidity rates, as well as means of transmission. Although local and public health agencies are the first to receive case data and determine how it'll be handled, the principal government agency that's responsible for keeping track of diseases is the Center for Disease Control and Prevention, or the CDC. They're located in Atlanta, Georgia. They've specified by law that there are certain diseases that must be reported. These are called reportable diseases. They put together a weekly notice on morbidity and mortality, and this summarizes the case rates and deaths for about 50 notifiable diseases. Now, eventually, the Center for Disease Control and Prevention will share their statistics with the World Health Organization so that we can have a grand overview of how diseases are traveling around the world. In this table, you can see some of the reportable diseases in the United States. So these are diseases that doctors must report should they come through a hospital. Take a look through it for interest, but by no means do you have to memorize all of that. So epidemiologists collect a lot of statistics. A few that they're involved with is the prevalence rate and the incident rate, as well as the mortality rate and the morbidity rate. So the prevalence rate is the total number of existing cases with respect to the entire population. This is like a snapshot in time, as in how many are there now. This is an equation we might use to determine the prevalence. The incidence rate is the number of new cases over a certain period of time. So this is the case rate or the morbidity rate. And again, an equation that would be used to calculate the morbidity rate. The only difference here is it's over time as opposed to a snapshot. Of particular interest to the CDC are statistics on sex, race, and geographic region. Epidemiologists are also interested in mortality rate. Mortality rate is the total number of deaths in a population due to the certain disease, whereas morbidity rate is the number of new cases over a certain period of time. Those are two terms to keep separate. Sometimes examination of the epidemic curve, or the incidence rate over time, or the morbidity rate over time, can help us determine whether an infection comes from a point source, a common source, or is a propagated epidemic. Now, each case has an index case. That's the first patient found in the epidemiological investigation. The top figure here shows the point source. If all victims exposed come from a single source, the example here would be a contaminated food item at a potluck or an individual dish at a particular restaurant. The second figure illustrates a common source infection. Common source is where it comes from a common exposure to a single source over time. For example, we might have a contaminated water source in a particular town, and so many people are becoming infected. We see an increased number of infections over time, and then they drop off. A propagated epidemic, on the other hand, is by a communicable infectious agent, like influenza. The lower figure shows this, where we see a constant increase over time, an epidemic exponential type increase. So when we consider infections and their spread across the country or the world, we have some terminology associated with that. So an endemic occurrence is where we see a chronic occurrence in a particular geographic region, here in the Southwest. A sporadic occurrence is where we see random small outbreaks here and there and everywhere. An epidemic is when we have a sudden acute disease outbreak affecting many people in a particular region. We've got a large population here, a large population here, a large affected population here and here. Versus a pandemic outbreak is where we have a worldwide epidemic. So we span all across the globe. This brings us to the end of our chapter on microbe and human interactions. Let's have a quick concept check before we leave. What term refers to the rapid increase in the incidence of a disease in a localized geographical region? Is it endemic, pandemic, sporadic, or epidemic? So pandemic we know means worldwide. Endemic we know means in a particular geographical region, but it's not a rapid increase. Sporadic means here and there, again, not a rapid increase. So epidemic is where we have a rapid increase in the incidence in a localized geographical region.